Hello, everybody. My name is Dr. Emery Pitcel. I am of Rothrock Chiropractic and Rehabilitation. We are in State College, Pennsylvania, a chiropractic practice with a strong emphasis on rehab concepts. If you are a patient of ours and you've had a tension headache or very upper neck pain, it's possible we gave you the McKenzie Method cervical and thoracic spine exercise packet. It's also quite possible that we gave you the tension headache principle that's on the second page of the packet. These are called seated or standing held retractions, and we're going to show how it could be a held retraction with or without a flexion progression on them. These work especially well for tension headaches. Let's just dive right into the technique right now and review it for you all. So the first thing to do is to make sure you find a seat that you're sitting in that has you in a good neutral spine. You don't want to be doing the exercise super slouched and in poor posture, but get yourself in a nice upright here. And what you're going to do is you're going to imagine that you're taking your head and you're taking your neck and you're pulling it straight back over your shoulders. So it looks like this, where you're going to translate and slide that head straight back. Now, we showed earlier for neck type cases like a cervical disc or a regular cervical derangement that this is good to do in repetitions. But we actually find that for more of the tension headache presentations, that it's actually better to hold that retraction position for 30 to 60 up to 120 seconds, because that's actually going to open up that nerve space and disc space and keep that pressure off, and it's actually going to melt down the suboccipitals and the upper part of the cervical extensors better. So it's going to look like this, where we pull back, and then you take your fingers, push them on the chin, and then we just hold here for like a good 30 to 60 seconds, up to 2 minutes. Now, if you are getting a little bit of a tension headache, what you might feel while you do this is it might actually increase the symptoms a little bit more while you're doing it, but it's important to kind of hold that exercise to a pain tolerance. So if it's making it turn on to about a 4 out of 10, we can live with that. If it's like a 5 or a 6, lighten up on your retraction pressure a little bit then. After holding for 30 to 60 seconds, what we can actually do is we could kind of do this as a bundle. So we could do the exercise as needed. So while you're feeling a tension headache come on, you can actually hold for 30 to 60, take a 30 to 60 second break, and you can repeat that cycle 2 more times. So then it's like, okay, the headache's getting a little better, but I might need 1 more time. Go ahead. You could do up to 3 sets back to back to try to nail down that headache. And if the headache isn't getting better, then that's usually when it's a better idea of saying, like, okay, maybe now it's time to think about taking something over the counter or a prescription that was given to you by your medical doctor. But if you do get relief with that, great. Another great way is to just be proactive about it and jump out in front of your tension headaches and try to work on that exercise every 2 or 3 hours or so. That's like getting 5 to 6 sets done a day of 30 to 60 seconds, up to 2 minutes. Now, some people do better if we have to progress the exercise. So instead of just doing a held retraction and holding, some people do better and need that progression that opens up the upper cervical segment more, stretches the suboccipital and the trigger points back there more. And that's by adding a little bit of a flexion progression. The way that that's done is it's the same as the first exercise, where you pull back and hold retraction. But now what we're going to do is we're going to do an equal and an opposite pull to push. So the amount of pressure we push on the chin is equal to the amount of which we tuck and pull back on the back of our head. So now it looks like this. Here's the held retraction, and then I hold that in place while I tuck and pull with this hand on the back of my head. And now I could hold this, same rules, 30, 60 to 120 seconds, and just let that melt and let that take that tension headache away. And you see, while I was doing that, at no point did I lose my good posture at the shoulders and the upper back. I didn't go like this and all of a sudden drop down. I stayed nice and neutral and made sure that all that stretch and strain was going into the upper neck there. Same sort of rules. That could be pushed into a 4 out of 10. It's probably going to turn on a little bit of a tension headache during, but the after response, as long as there's relief afterward, that's what we really care about. So this is specifically designed in the McKenzie Method to work really well for our tension type headaches. Those are the headaches that start in the back of the head and start to wrap their way up and forward as they continue to regress and get worse. We also find that this exercise is sometimes really beneficial for our cervical myelopathy, extreme cervical stenosis. Sometimes it responds even pretty well to pretty intense cervical radiculopathies down into the arm. Regardless, if we've given you this exercise and it's helped you, stay with it until proven otherwise. And if you aren't a patient of ours and you happened upon this video and you tried this and got some pain relief, first of all, we're happy for you. Second of all, we'd love if you left a comment, hit a like button, or subscribe to our channel, or share this video with somebody else that could benefit from the exact same exercise you did. Until next time, everybody, we appreciate your continued support out there, and take care until we talk again.